More people are starting to talk about it.
Over the past number of years, we've seen tremendous discussion, we've seen a tremendous increase in public awareness.
Now we're moving into a stage where we can actually start to make some changes.
The strides that we need to take next is really moving these discussions from awareness to action.
There's two factors that get in the way of people getting the services and supports that they need. The first has to do with stigma. There's a lot more public awareness, which suggests that stigma, hopefully, and will continue to be on the decline. The other barrier to accessing service really has to do with how services are funded.
We see such a significant rise in the burden of mental illness within society, and we're also feeling that strain on our nurses and healthcare providers, because the resources aren't available, the funding doesn't match the issues that we're facing out in the big world around mental health issues.
Accessing services and support for mental illness is difficult across Canada, especially in some of the rural areas and especially in some of First Nations communities.
It's simple to say it, but it is a fact that funding is probably one of the major limitations on access. And the Mental Health Commission of Canada has recently made its position clear that they would like to see the proportion of health budgets increase from 7 to 9%.
There's a big chunk of service providers in the mental health community, psychologists, myself being among them, that are not covered by public health insurance plans if those providers are not salaried by our public institutions, like hospitals, like schools, like jails. So when they're in private practice in communities, people pay for them out of pocket. If you really have an urgent mental health need and you're in crisis, you're going to emergency at the hospital, which is a very expensive door to go through.
But the approach has to change. We have to invest in those resources and services and create a safe space for the recovery to occur.
I work really closely with employment and mental health, so I think that there's a lot that needs to be improved with helping those living with mental illnesses, securing employment, maintaining employment, or even volunteer positions, helping them live meaningful lives in the community.
Investing in mental health is really investing in ourselves and in our communities. It's investing in our brothers, our sisters, our mothers, our daughters. It's meeting the needs of our communities and meeting the needs of our families.
The institution of the Mental Health Commission of Canada has been a major advance. It's been funded well to do the work it does. It's been able to initiate innovative projects, including a major housing project which has been very well reported and which has been very successful.
They produced a strategy which has a number of goals. They've made recommendations about how to deploy funding, how funding might have to increase in order to do a better job at making services and supports accessible.
The National Mental Health Strategy of Canada really is a roadmap Canada can follow, from the provincial, territorial, to the municipal level, to the community level. It's really a path in which that we can move forward with addressing mental illness and mental health and addressing the gaps that are within services.
Mental health issues are so multifactorial that we do have to work as a team and have to come at it from many different angles.
What we need to do is work as a team and share our information, share our resources, share our expertise, so that we can really look at mental illness as a whole and treat it as a whole, instead of just working in different subsections of mental illness.
CAMI was instrumental in getting the Mental Health Commission of Canada established, which delivered the first and only national mental health strategy that we have in Canada, and it will be instrumental in ensuring that that national mental health strategy gets implemented and meets the needs of all Canadians.
What CAMI does is it utilizes all these different experts from different associations, different professional backgrounds, different walks of life. It really emphasizes policymakers, it uses their knowledge.
And it kind of makes it real. It's kind of the bridge that brings that world together, so we can create some relations and guidelines and structure to creating a healthier peoples.
We will do better, we will have more impact as a collective rather than with individual voices. We see the power of that collective voice now beginning to actually influence matters and influence the business of government and the impact that we can have.
CAMI is a tremendously important alliance. It's important because we work very hard to make sure the voices of families and caregivers and persons and providers are all heard. And I think it's also important for funders, because it's a lot easier for funders to go to a large group like CAMI and feel confident that they're getting more of the 360-degree aspect of a problem.
The Canadian Alliance in Mental Illness and Mental Health is very important to Canadians, because whether we like it or not, we're all affected by mental illness and mental health. And CAMI provides a unified voice on the national stage that pushes the envelope.